immediate future if we do not take further action. This would mean the virus is approaching a tipping point where it would or could rage through our population and put seniors in our long-term care homes, for example, at risk, or kids in school for that matter. We've always known a resurgence could come and that further public health measures could be needed in order to combat the virus. We've been talking about this for some time. Dr. Davila will discuss the details, but she is recommending an indoor dining pause for the next month, that people only leave their homes for essential activities, and that indoor gym classes be discontinued. This is strong medicine, and I know that it will be bitter for the businesses directly impacted. But now the resurgence is here, and our doctor has issued a prescription that we must follow. Throughout this pandemic, I have followed Dr. Davila's advice because she is our public health professional, and this is a public health emergency. Dr. Davila has been clear that if we don't follow these recommended actions now, the measures needed to bring the virus under control weeks later will be much worse and will last much longer. As she will tell you, I ask many questions when I receive her advice in our meetings, and I can tell you many of those questions concern the evidence itself and making sure I understand it because I am not a scientific or medical professional, and the impact of the proposed measures that she advises us that she wishes to take or to see us take. But in the end, we have accepted that advice, much as you would do when you receive a recommended course of treatment following a diagnosis from your own doctor. Her advice to date, which we have followed, has saved lives, many lives, protected the health of our city, and allowed us to reopen much of our economy. Now that she has delivered additional advice that will unfortunately cause hardship for parts of that economy, it will hurt restaurants who are already struggling to survive. Restaurants will still be able to serve people on patios, and we've done our very best to expand those patio options, and I'm now even looking at trying to do so into the winter so that we can have more opportunities for them to do business. They will have the opportunity still to offer takeout and delivery, and I encourage all Toronto residents, assuming that we are in a position where these restaurants are indeed closed for indoor dining, I encourage all Toronto residents to support their local restaurants as much as they possibly can during this difficult time. Any place they can, anywhere they can, anytime they can. I know Dr. Davila does not do this lightly, and my support for her recommended action, my complete support for her recommended action, is not given lightly. Now we have presented these recommendations to the province for their consideration, and there are very constructive discussions going on around the exchanges back and forth between us. We have had excellent cooperation with Premier Ford, Dr. Williams, and the province throughout this pandemic, and I'm confident that that will continue. I want to thank the province for taking action across Ontario on masks today and on pausing social circles and advising everyone to have close contact only with the people that they live with. Dr. Davila knows, and I know, that these measures that we have recommended have real-life consequences, and we will work hard to do everything we possibly can to secure the promised support, especially from the Government of Canada, for restaurants and other businesses impacted by public health measures. I talked to Deputy Prime Minister and Finance Minister Chrystia Freeland several times this week, as recently as this morning, and she confirmed once again, as she has done publicly, that they are working to launch a program to help hospitality and other businesses through these tough times, and they're looking to do that as soon as possible. I believe a simpler program with targeted help to these businesses along the lines she described to me will be of immense help to those businesses. And she is working, she told me, and gave me permission to say this publicly, she is working to make sure that that program is retroactive to October the 1st, and I'm confident she will be successful in that regard. So I'm confident that help is on the way, leaving aside what the province might do, and I will continue to fight for that help until it is in place and in the hands of those who need it the most. We need to take this pause now to slam the brakes on the spread of COVID-19 in areas where we know it is active in our city of Toronto.